Welcome to the 6th module on health financing. There are 3 units in this module, and in this first unit, you will be learning about what is health financing, the place of health financing within the health system, and you will also discover who pays for health services. What is health financing? Health financing is concerned with how financial resources are generated, allocated, and utilized by the system. Usually generation is by the government or by insurance companies or by individuals themselves. Allocation is by the government, whether they want to allocate more for primary health care or for secondary health care. And then the utilization depends on the providers, which is the hospitals and the clinics and the doctors and the nurses. Remember the health systems framework which you learnt in the first module. We had the inputs in terms of human resources, in terms of drugs and medicines, infrastructure, and finances. Then you had governance, health services, etc. So the finances is a very important input into health service, into the health system, which generates the health care and then of course the health status. Now, many of you all may wonder what is the relationship between finances and healthcare. After all, healthcare is about healing. It is about curing a patient from an illness. But so where does money come into it? But you need money to pay salaries for your doctors, for your nurses, for the pharmacist. All these people need money. In fact, if you look at it, most countries, salaries form a substantial part of the health budget. In our country, it used to be about 80 to 90% of the health budget spent by the government was on salaries. You also need money to buy medicines. Even if you want to buy antibiotics, you want to buy IV infusions, all this require money.
To learn more about health financing, join ePHM by clicking on the link below.